wait to see if any of our citizen members join us.
Oh, Bonnie is not coming and Alex is not coming.
I knew that Alex wasn't coming.
And Bonnie is not either.
Okay.
So the only potential would be Bill.
Right.
1, 2, 3, 4, 5.
And did you get a hold of Gary?
I just texted him. I'll try to call him.
KT, I want to thank some of your staff. The other day I was down making a big ask to help somebody retain some dignity.
There he is.
So they provided some things that helped us to get them back out. So thanks to them.
Good. Absolutely.
Your staff too, Chris. I started there. I was going around asking any department, begging for some stuff. Your staff was searching for some things for me too, but it's tough to find a pair of pants in the building.
Adult men pants.
Chris,
Gary.
can you hear me?
Yes.
Are you talking to me? I can't hear you.
Yes.
I can't hear anybody.
Okay. So Krista, I would guess
I'm thinking the volume on his speaker is probably down on his.
That's me too.
If you could just text him that, turn the volume.
I'm going to send it to him in a message. He's good at.
Probably a good team. Good. You don't want to hear me. I understand.
Not so.
You guys must have been talking to my wife, huh?
Can you hear us now?
Apparently not.
And
Hello. I don't know who you're talking to, but I can hear you.
Good.
We are
Trying
talking
to
to
get to
Supervisor
Gary.
Steen. We're having just a couple of technical issues here before we get started.
Krista, do you know, I don't have my laptop right here. Do you know where is the volume button on them? I'll look at mine here.
I
Hiding.
don't know what laptop he has, so I couldn't tell you.
Well, he's got one of these county ones. I think we've all got these Dells.
Yeah. Yeah.
On the lower right-hand corner in the blue strip that's on the bottom.
Or on the key.
If he presses the function key and F3, that will increase the volume on his laptop speakers. He has to hold the function key and press F3.
What the heck's a function key?
It's right next to control and that little window button. It says FN. It missed the U. It's not a fun button.
Gary, can you hear us now?
That's a great.
Turn your
You
speaker
have a
on.
better thought than I do.
I don't have a little FU by my control.
Press
FN.
It is.
FN.
Can you hear? Can you hear?
Yes,
Can you hear me?
we can hear you.
Yes. Can you hear
I
us?
I can hear you and F you everybody too. So there.
Oh, goodness. Members of the public, we don't usually have this much fun
Or this much trouble.
or this much trouble. I'm going to go ahead and call to order this meeting of the Health and Human Services Board for Thursday, October 28th. Welcome, welcome everybody, and let's hope that we can manage to work our way through this tonight. And welcome to anybody who is persevering with us on the county YouTube site. It looks like everyone is here, including Chairman Bartlett, and with the exception of Ms. Barker and Dr. Hall. Do you need me to do any other calling of the roll, Chris?
No, I'm working my way through it. I think we're good.
Okay. All right. First item of business is approval of the minutes
I
from
so
our
move.
September 23rd meeting. Supervisor Dean moves. Is there a second?
I'll second
I'll-
it.
Supervisor Cromie raised her hand first. Any additions or corrections? No additions or corrections? If not, all in favor signify by saying aye.
Aye.
Any opposed? Minutes are for September 23rd are approved. The next item of business is that our next two meetings in November and December both fall on holidays. I have suggested that we move our regular meetings up a week to our sort of traditional third Thursday. So that would be November 18th, Thursday, November 18th, and Thursday, December 16th. Does that work for everyone?
Did you say November 11th?
No, I said November 18.
Oh, suggested dates. I apologize. Yes, that works.
That works. Supervisor Steen?
Yes, December works for me. November, I'm having my knee replaced, so I will be able.
Oh, okay. We will be thinking of you. We will be thinking of you. Absolutely. That's not a very good way to celebrate Thanksgiving.
Well, no, but it is what it is.
Exactly. Okay. All right. Well, let's go with those dates then, barring any objection. All right.
Diane, do you want to go back and check and make sure there's no public comment? I don't believe that
Oh,
there
and
is, but
you're
Krista.
absolutely right. I did miss that. Krista, is there any public comment?
There is no public comment.
Okay. Sorry about that. Okay, veteran service is next up. Greg is here.
Good evening, everyone. Just a thumbs up if you can hear me okay. Okay. Gary, I think I sent a direct message to KT, but just again, part of my report, we do have a medical equipment loan closet and lots of individuals that have some joint replacement. You certainly get a hold of us. Don't buy any equipment. We might be able to borrow it to you. Okay.
Thank you very much. I'll use what I can.
Okay. All right. So I'll start off tonight's report with office update, and in your summary page that should be in your packet. I'll start with the local items. We finished up our for the month of September. Finished up our outreach event with the Dunn County Historical Society, and I know I've spoke briefly about that event at some previous Human Services Board meetings, but it was great partnership, great building over there. It's I think a very hidden asset within the county, and we certainly are looking forward to doing some future partnerships with them. So part of that, there was a group of Vietnam veterans that they had the building to themselves for the display to kind of honor and give them their time there. And I think that was well received, and we had a guest book so individuals could put a personal message in there, as well as identifying on a map of Vietnam with a pin where they actually were located or served in Vietnam. So that was, I think, just kind of a nice little touch with that. The other thing, last year it was canceled, but we work with the local pipe fitters, 434 union. They have for quite a few years now, since I've been in this position, been great about, they do a heats on furnace program. And in the past, they had attempted to more work with, I think, a broader population, but they've narrowed it down. And so they provide their services for veterans and surviving spouses. And they donate the vehicles. There's a number of union outfits in the Eau Claire, Dunn County area. So those businesses donate personnel as well as their vehicles, and it's a way for them to give back. And so we had about 15 veterans that they went out in the attempt is to just do a good cleaning on their furnace. And years past, some of their suppliers, they've actually replaced full furnaces. They go above and beyond. No reports of something that to that degree, but the report is it was very well received, and especially at this time, those on fixed incomes right now are being hit the hardest from the position I sit in, and so anytime they can get this additional support and just that validation for their service or for their spouse's service is been well received and beneficial. A couple other things I'll just give a little heads up on, because we won't be together again prior to Veterans Day, which is on November 11th. So anyone listening or those here amongst us that are veterans, kind of my ahead of time or premature thanks for your service. And I know Chairman Bartlett, I kind of mentioned something to Mr. Miller, and I think there's an intent at the county board meeting to thank those within the county board service supervisors that served as well. So I appreciate that. Any recognition, any pats on the back we can give to one another these days can go a long ways. We're going to be working with the neighbors of Dunn County to provide a recognition on Veterans Day. It'll be in the afternoon at 2 p.m. and they're going to host it in one of their buildings. In years past, we've done it in two. So, and of course, everything will be subject to change, of course, if there's any change in environment with COVID. But right now, it stands. We'll be able to do some in-person recognition for some folks over there. And another thing that's not on here, which I'll be reporting a little bit further, we've been working with UW Extension, Pepin County Service Officer, as well as Buffalo County Service Officer on a partnership to really kind of an early intervention type partnership. We did a lot of surveys. We have a training presentation designed, and today, this afternoon, actually at 3 o'clock, was the first run of that. And so we have a law enforcement officer down in Pepin County that is partnering with us, and he's delivering that and trying to do a little bit of a training for local law enforcement on basically some of those things to look out for, and are working with veterans, some key identifiers, going through triggers, and he's also a veteran himself. So it was an incredible first go around, and he did it amongst his own cohorts. And so we're hoping to get something here in the coming months to work with our local law enforcement. But in the end, bottom line, it's to save lives. And that's in some of those early interventions to get people connected with the right resources, and partnering with our other service providers can do that. So I'll have more to report on that once we get some things scheduled here in Dunn County. But the first pilot was down in Pepin. So then next item, I also put in your packet a letter from Representative Edming and Mr. Edming and Andre Jock from Wisconsin Legislature, just an update on a bill to expand property tax. They call it property tax relief, but it's a property tax credit. And right now, those surviving spouses of veterans who are 100% disabled due to service, or individual veterans that are 100% disabled due to their service to the country, are eligible for a property tax credit. It's their home in 1 acre, so it's not the whole farm. But it has a significant impact. I think roughly here in Dunn County, it's a credit, I think about 80,000 or so, as high as 90 in the past. So they're looking to expand that so that it actually ranges down to veterans that are 70% disabled. And so it's a prorated amount. And so that's been in the works for a while. So it's got some nice momentum. So I'll keep a close watch on that. On the federal benefits side of things, We're still caught up in the quicksand of the VA's appeals system and the backlog. There's lots of media attention surrounding that. They've allegedly hired a number of more personnel to help with the backlog. So hopefully there'll be some improvements as we move forward with that. And then another, I'd say, concerning thing, and I spoke with our child support director regarding this apportionment program. So if a veteran has an obligation to dependents and they're failing to meet those obligations, that somebody on the behalf of that dependent can file for some of that money or through their disability, and it's called an apportionment. Because the VA is not good federally at recognizing any type of child support orders. And in my time here, I've only seen, I think, one that they actually were honored it and they were collecting the child support directly out of the compensation. But an apportionment is another route. Our here, based upon the ethics of what we do, as well as ensuring there's no conflict of interest. If we have a relationship and working with the veteran, then I have to find another one of my cohorts in another county or in a local regional office to work directly with the person representing that dependent, or directly if it is the dependent that let's say that is disabled and over the age of 18. So we have to just always manage those conflicts. But we kind of went over that. There's a few each year that we have to do, but in the end, there's ways to ensure obligations are met. And so we work within trying to manage any conflict of interest, as well as ethics, to make sure we don't violate any of what our responsibilities are with our accreditation. But the VA is proposing to do away with even filing apportionments or processing them, and because it's not a high priority workload with them, good, bad, or indifferent. It's the nature of them being understaffed. The next item, financially, they're still at this point of the year, nothing significant to report. Negatively, financially, I suppose on a positive side, we're getting really our requests for any type of financial assistance has really been reduced this year. And my assessment of that is that there's all kinds of assistance, stimulus money that is out there. So that's really taken the load down, where people don't end up coming directly to us for some of the direct assistance. So it's went down a bit. And on the COVID front, business as usual. Nothing has stood in the way of us delivering our services. And then we still have a couple volunteers coming into our office working with us. It's incredible, because we actually have one of our veteran volunteers that cleans up the medical equipment as it comes in, which I think is an important thing, especially with how much of it's coming and going. Any questions about that part of my report?
Greg, I'm curious about the Heats On program. How are the veterans or their families identified for that service, which sounds wonderful?
Yeah, it's a whiteboard action. So throughout the year, with all the programs that we do, because there's quilts, people donate quilts as we near Veterans Day. So we kind of have a whiteboard, and as we have individuals identified in need, they own their home, or veteran newly purchased a home, we just start making a list. So we don't. And we'll have individuals that will contact that want to do it again, but we try to limit it so it's not. It isn't designed to be an annual event for one particular individual. It's to spread it out. So there really isn't any stringent vetting process, other than they're on a fixed income, they're in need, and we keep our list for a variety of things, because we always have people coming to us wanting to provide gas cards or some type of food card. And so we try to keep lists of those in need so that we can react quick. We don't want to ever pass up an opportunity. Long
Thank you.
explanation, have a whiteboard, write down those.
Thank
Sorry.
you. Brilliant. Brilliant.
So I'll move to I've also submitted in the packet a 2021 Veteran Served Report, and I always put in the 2020 Excel spreadsheet so that you can have somewhat of a comparable to look back on the activities from the previous year. A thing worth mentioning, and it makes sense based upon the healthcare and getting back to providing a lot of the I would say non-essential type activities. So if you tabulate from January to September of 2020 versus current fiscal year, medical equipment loan closet, you'll see an uptick in the total amount that have been borrowed out, and that I think that's just a sign of things getting back to more normal, because people are starting to get their knees done, hips, backs, and stuff. So that I anticipate that continuing to increase as the rest of the year finishes out. On our impact statement, I know that I'd mentioned previous month about a really big find when we're going our benefit specialist in our office going through files, and as we're scanning it, and we never intend on ever hiring a scanning service, because what happens with situations like that, you have the possibility of losing valuable information, but you put your own hands on it, you view it, you may catch certain things that need to be fixed, or mistakes that in this instance the VA made. There was a discovery of an incident where they had made a mistake, and going all the way back to 1986. So we're still kind of waiting on the final numbers, because the surviving spouse has been approved for benefits dating back to 1986. We were estimating close to $500,000 to $600,000 back pay that she'll receive. However, it's going to be less than that. The reason being is we didn't look at the next layer behind the curtain. Her husband, or the veteran, was a retiree, so you can't receive both of the benefits at the same time. There's a survivor's benefit as well as a survivor's benefit plan through the retirement system. So there's an offset there. So it'll still be a significant amount of money, but not. We're estimating probably about 300,000. So that's a benefit of putting hands on and cleaning up some of your older files as you close things out, because that was definitely a good find for that family. The other impact statement they mentioned, I'd been working with a family for a long time, since I'd been here, with a variety of benefits, and this poor veteran had dealt with squamous cell carcinoma, its tonsil neck region, and then subsequently to that, scleroderma. So a whole bunch of impacts, and that has a large negative effect on your earnings and stuff. So it had been a long road, and we've been working on a lot of other veteran related benefits, and one benefit came through, so it was nice. And now the family's taken care of here. They have a very, very nice safety net with the retroactive pay of about $52,000, and things are tight for them. They're one of the families through the years that fixed income, and any little bit of help and assistance they can get and they're very humble and appreciative. And so now this really has kind of opened up a door, taking a lot of that stress, because stress, as we know, also causes health issues. So hopefully now they'll be able to do a little bit more thought about the future and feel that. So that's definitely a good outcome. Pending any questions on the impact statements, and the activity chart. I can answer any questions regarding revenue and expenditures. And again, educational, just to put out, we have 3 cost centers within our budget. One is more of our operational funds, which is just salary, paper, any type of mileage, travel, and then we have a Soldiers and Sailors Relief Fund, which we had less requests for assistance this year, as I'd identified earlier in my report. And the last is a $10,000 grant that we get from the Wisconsin Department of Veterans Affairs. And again, the anticipated budget will all come in as it should, and pending any big uptick in need for utility assistance or rent assistance, everything will be in good shape. So I entertain any questions. Anybody has any questions regarding my report?
Any questions for Greg? I guess not. As usual, thorough and informative. Thank you, Greg.
All right, thank you.
Oh, Supervisor Steen, I'm sorry.
Yeah, Greg, I'd just like to thank you for your work for those veterans, particularly pointed out those 2 things that you had at the bottom of the sheet there. I mean, that's life-changing for a lot of these people. And I'm so proud to be associated with you, and you're doing that good work for our people. I thank you for that.
You're welcome. I think it says overall the whole county wins when we have outcomes like that.
Thank you for that comment, Supervisor Steen. I think that we all agree with that. Thank you. Thank you, Greg. Okay, ready to move on to public health staff report. KT sent documents prior to the meeting. If you haven't yet checked your email, then I'm sure she'll go through that with us. Go ahead, KT.
Sure, guys. So what I sent you in your packet are some informational items predominantly on COVID. So you have the weekly update that I always send with a bunch of different live links in that PDF. So if you wanted to do some additional reading, you can unpack that a little bit. One of the live links in that weekly update is an MMWR, or a white paper that really talks through the safety of vaccination, and they do that using a very large sample size, and they look at non-COVID deaths associated with folks that were vaccinated versus folks that were not vaccinated. Nearly 10 million people between the people that were vaccinated and the matched unvaccinated people. So a very, very large sample size. Encourage you to take a peek at that. And then the respiratory report, that's another thing that you guys have seen routinely. I'll let you guys peruse that. But the gist of it is we are starting to see influenza the way we normally would see influenza this year. And that makes sense because a lot of the mitigation strategies that people used last year really aren't as commonly adhered to this year. Also, within that respiratory report, you'll see that we're continuing to see a lot of RSV and other respiratory viruses. Unfortunately, we have had we've had a lot of RSV here, but we have had some RSV resulting in hospitalization. And so that is something to be aware of. It's just been a very abnormal respiratory virus year for a lot of different reasons. And then you guys have kind of a written report for me, and that does go through the normal COVID metrics that I typically share. So looking at onset, and you'll see that graph. I can put this up on my computer if that would be helpful. Share my screen. So this is the same as the printout that you have, and this should look familiar. This is cases over time by onset of symptoms. And so as always, the very tail end of it is still pending. So oftentimes people will be tested later on in their illness, and that'll add to it. But you can absolutely see that we are seeing a reduction in cases. So as a 7-day average, we're at not quite 17 cases a day between confirmed cases and probable cases. And you guys will remember that probable cases are the antigen positive cases that you would see from folks that were tested over at the Stout community site. And so we are down to about 17, where a couple weeks ago, you can see, we were really up closer to 30 cases a day, with some spikes up in the 50s. So I'm grateful that we are seeing a reduction. I think the challenge that we all want is we want to be done with this, quite frankly. But the challenge that we have is that this timeline also overlaps with this timeline. And so everybody's just kind of holding their breath to say, are we really to the end of a surge, or will we see another uptick due to the way people spend time together indoors, especially over the holidays? So I think that that's important for you guys to see. The other things in this report, you have some updates on our public health nutrition program. I know that there's always interest in how many dollars we are getting to farmers for fresh produce as a win-win, and it's almost $10,000 this year. And so I think that that's really important for you guys to have some awareness on. And then wanted to give a verbal update on staffing. So we have increased a significant amount of our contact tracers. So we hired 6 new contact tracers in the last couple of weeks. And so that brings us totally to 29 people, if you include our health educator and public health nurses, with a hand in contact tracing and COVID mitigation. So a significant portion of our team and our expanded team doing that work. As a reminder, typically we're a staff of 12. So really expanded. Excited to say that I have also hired for the environmental health positions, both the specialist and the manager. I am not shy to say that we stole them from adjacent counties, and I'm super excited about that. So folks coming in to hit the ground running to really meet the community need as far as environmental public health as it relates to water safety, food safety, that kind of thing. So I'm grateful for that. And then I think those were all the resources that I sent to you. Any questions about what you're seeing, or maybe any questions you have about anything in that report?
Any questions for KT? Our vaccinations are still slumping.
I have a question.
Sorry,
Yeah, Supervisor Bjork, go ahead.
Thank you, Mr. Chairman. At the county board meeting, I asked Mr. Miller, I thought, a real simple question that had to do with a report that came out of one of your Monday morning meetings. And I was asking him if we are now counting cases, or are we counting individuals? Trying to get the example. He didn't answer the question. Is reinfected, is that reported as one person or 2 people? Or where is this reinfected number? How does it come up? I don't know how to ask it any differently.
No, I understand, Supervisor Bjork, and I think that it is a pretty straightforward question if you're kind of living in this environment, which Administrator Miller is not. So in October 1st is the date that it switched over. So previously, reinfections didn't go into our case count in any way, shape, or form. People had a positive PCR. They had a positive PCR a year later. That second PCR positive case, even though they were symptomatic and could spread, didn't go into our case counts before October 1st. They were counted separately, and we honestly didn't have a ton of them. In the last couple months, we've seen, and this makes sense as natural immunity wanes, we have seen had seen a significant increase, and it had been a pretty long time between when some of these folks were first infected and then when they had a second infection. So the state updated their case definition of COVID-19 infection on October 1st to now include people that have a second infection. So they've tested PCR positive or antigen positive more than 3 months apart as a new case. So whereas we used to count people, now we are counting cases. It is a more adequate reflection of the activity in the county. But I would share, Supervisor Bjork, that it's a very small number. And I would also share that something that doesn't make it into our case counts, and I don't anticipate it will, is folks that are tested at home with an antigen. So those help inform people to make good decisions about their own risk towards others. If they think they were exposed to somebody, they can get a off-the-shelf antigen test from whatever pharmacy, they can take it, but that never makes it into our numbers. So there are some difficulties with counting cases. And we're doing our best to try to make sure that people have an understanding of the risk, but then it can also balance that privacy and making good informed decisions for themselves individually. Does that help?
Yeah, it really does. And I don't want to make any indication that I lean one way or the other. It's just that I want the general public to know that we're not trying to inflate our numbers. And one thing I'd like to mention personally and countywide, that a good neighbor friend of mine is battling COVID in Eau Claire right now. And his father was a Dunn County employee for 30 some years. And my friend grew up in one of the houses there at Government Center, wherever you call it now. So, I mean, I think it's very, very serious thing that we keep track of, and it's just not give the negativity that we're trying to inflate numbers. So
I appreciate that. We have had 46 Dunn County residents lose their life. We have had many other people be hospitalized. We are seeing, and you guys will see that in the Monday report, overall a reduction in hospitalization, but an increase in ICU usage right now. And we have had several recent cases that are still, and by several, I think about 7, that have been in the hospital for more than 30 days. These folks are typically younger. And it's just a really hard thing to come back from. We're also, something that doesn't get reported, we are seeing in our data that pregnant people that are COVID positive, we've had 3, I think, very recently go into premature labor, and we have had a fetal death as well. So just really, really significant for these families, and they are real people in our county, and it is very hard for many people that are COVID positive.
thank you for your answer, and thank you for your service. And I always keep going back to that application where you're looking for new and expanded areas to work in.
I appreciate that, Supervisor Bjork, but this was not on my 3 or 5 year plan.
Are there other questions for KT? Supervisor Steen.
Yeah, KT, my wife and I just got our 3rd shot. We got it at Walmart. And this is just anecdotally, but I go there a lot because evidently I'm a drug addict. And it just seems to me that they're fairly busy in their immunization site there. So that's good news, but maybe everybody's getting their 3rd one. I don't know.
So we have a lot of our pharmacy partners that are providing boosters. You can get a booster here at the health department if you started your series with the Pfizer vaccine. But other community vaccinators are still very much providing boosters to folks that want them. Soon we'll have that same availability for folks that got a Moderna shot or a J&J shot here shortly. The health department will not be providing Moderna. We're not going to do both Pfizer, J&J, and then the pediatric doses in addition to Pfizer. So we're going to limit what we provide. But for folks that did get a Moderna shot that want to get a booster, I would encourage it. If they have questions, talk to their doctor, and then return where they got it before. Our long-term care facilities are actively working with their pharmacy partners to bring them back in to provide boosters for folks that want it. I will share with you that we have had cases in our long-term care facilities. They're typically representation of community members, so not necessarily residents. There are parts of the state where they are having active outbreaks in residents as vaccine-acquired immunity starts to wane. So it'll be important for us in our community to prevent additional death and illness to get folks that want that booster Moderna shot.
Thank you, Katie.
Katie, will the health department be doing pediatric vaccinations?
So we have ordered pediatric vaccine. We do anticipate that it will be here shortly after the ACIP makes its decision. And then, the ACIP advises CDC and the CDC makes its decision. Our hope is that parents take their children to their primary care provider because they really do know children best. Children don't do as well in a mass vaccination clinic setting as adults. And so we want them to reach out to their docs. But for any place where there is a gap in vaccination or somebody that doesn't have a medical home, or they have concerns or phobias about clinics, we will be there to bridge that gap.
Supervisor Steen.
Yeah, I guess I'm showing my age here, but when my wife and I went to school, they did a lot of the mass vaccinations through the schools. Either at the school or they would take buses to Menominee or Eau Claire to get it done. Do you see that happening that way or not?
So we were actually today in Boyceville providing influenza mass vaccinations for families that wanted that done. I think COVID is a little bit different because of the consent that's required. We do want consent from parents actively there, and that can be challenging in a school type setting. Whereas with influenza, they can sign something and send it in. We actually want to have that parent there because we want to be so very certain that there is informed consent on behalf of the parent. We would go where the community asks us to go, but at this moment in time, we don't have any plans to provide COVID vaccinations for children in school settings.
Thank you.
Any other questions? Thanks, Katie. Want to do a financial report?
Sure. Sarah, do you want to, or do you want me to? Because I can.
It's up to you. I'm here to support if you want to go, and I will field some questions if you want.
Awesome. Okay. So what I sent out to you today, I'll go ahead and share that screen as well. Starting with our expenses, these are year to date, and most of them have been very much cleaned up, making sure that we are appropriately taking things out of administration and putting them where they belong in either grant funded work or, grant funded works. Sorry to be redundant. A couple of the things that you need to have some awareness around, obviously, when we had staffing vacancies, that does result in diminished expenses. But we do anticipate that with hiring on the two new EHSs, environmental health specialist and environmental health manager, that we will have an increase towards the end of the year, and we have accommodated for that next year. I do want to point out something that does make me scratch my head. We have really pulled out our public health nurses from a lot of our reproductive health work to support COVID mitigation. We are looking at, because we can use Title 10 and Title 5 federal dollars for COVID work, in order to not leave any of those dollars on the table, make sure that we don't have any double dipping, no supplanting, but make sure that we do spend out those dollars. And I'll show you in the revenue where we're at with that, but that is a very low number. Additionally, staffing for communicable disease. I want to share something that also made me kind of scratch my head a little bit, that we did have all of the COVID retention bonus go into communicable disease, and then it was dispersed into the different cost centers where people were working. So while it shows the 66 coming in and only 33 going out, if you total up the other parts of the cost centers, you'll see that does add up to the 66,000, just for your awareness. Looking at revenue, starting at our bottom line, we do anticipate that we will have more revenue than we had originally budgeted. And our bottom line is that if things go the way they currently look to be going, that we will be returning some dollars to general levy as well. I did want to just show revenue for environmental health, since much of that is separate, where we look at different licensing, and we are on target for that. Any questions?
Any questions for KT on the financial report? I guess not, KT and Sarah. Sarah, you have anything that you'd like to add?
No, KT, you did a great job. Thank you.
Supervisor Steen.
Yeah, KT, no questions for you. If Sarah would have did it, I'd have had a lot, but good job.
You'll probably have another opportunity. All right, is that it, KT? Thank you, good report. Good report. And now we turn to Human Services. Chris, you are on.
All right. Well, I'm going to just have a pretty short report at this part, because we'll spend a little bit of time when we get to approval of the 2020, it's actually 2022 to 2024 aging plan, but we'll get there. But I did want to report out on on a significant change that has been occurring over the last several months that I'm finally in a position of being able to share with you. So as you are well aware, because we've discussed it on a number of occasions, the Human Services Department has had a long-standing relationship with House Calls as the employer of our leased staff. And that relationship started literally decades ago, when the county was both the determiner of eligibility for long-term care, meaning we figured out whether or not, if you couldn't afford to stay in your home, or not should I say afford to, if you were not functionally able to stay in your home as you got older, or you were a disabled adult and you were requiring services in order to assist you in staying in your home, or you were requiring services in order to stay in a congregate living kind of situation. We were the determiner of your eligibility for that, but we were also the provider of that service. So back in the day, and I'm talking about pre-2008, the county had significant contracts with two organizations, one called Gemini Employing Leasing and the other House Calls, to employ those staff who were working in the homes with people. And then that relationship with House Calls continued after the county, after long-term care was redesigned, and the county remained the eligibility determiner, but not the provider of the services. Those provision of services is now accomplished through the managed care organizations like Inclusa or Care Wisconsin or those types of organizations. But our relationship with House Calls has continued over the years. And in fact, after the end of collective bargaining, it grew in part in an effort to be to be cost effective, in part in an effort to be efficient, because there are a fair number of revenue sources, grant types activities that come through the door that we aren't necessarily sure always are sustainable over the long haul. And working through a leased organization had an ability to bring on staff quickly and for an indeterminate amount of time in case the funding ended. However, the county has on a regular basis looked at that lease arrangement. In the middle of all of that, employment law continues to grow and evolve. At some point in the not terribly distant past, there was a new definition of a relationship in which two organizations could have, in which you could be a joint employer. And in those situations, it was there's a concept in law called joint and several liability, meaning that we assign the responsibility for, say, restitution to everyone who was a party to the action. And the hope is that everybody pays their part. But if they don't, and only one poor soul ends up paying, and all the rest of them abandon the plan, that one poor soul has to pay everybody's. And so there's sort of the same thing in a joint employer relationship. It's predicated on the two parts of the relationship, both doing what they need to do to make sure that the legal and employment responsibilities are covered. We've never had any issue with that with house calls whatsoever. They've been an awesome, awesome partner for all of these years. However, there is now a newish sweet spot between the Fair Labor Standards Act, which is federal law related to employment, the Wisconsin retirement system, which has a book full of rules and requirements around participation in the Wisconsin retirement system, and the IRS. And the sweet spot of that has gotten stickier. And after seeking legal counsel, independent outside legal counsel from two separate sources, conversations with the executive committee as well as the committee on administration, we made a decision a bit back to end our contract with house calls at the end of this year, 12/31 of 21. And those staff will all be offered positions with the county as county employees. So I apologize that in a sense that you sort of get that now. Some of you may have been, I know some of you had some contact with some folks that were affiliated with house calls. You may well have had other conversations related to this from other people in county government or whatever, but that the decision is made and the plan is moving forward to do that transition.
And if I may, I'd just like to emphasize that this was not an accountability or a performance issue in any way.
Not in the least.
Not at all. And Supervisor Steen.
Yeah, Chris. So my question is there any outstanding or monies that have to be paid to catch these people up in some way? Or are they starting new from, let's say, the first of the year, if they're going to be employed by the county? And I'm pointing my question really at the retirement system, things like that. Can you enlighten me?
Sure. So there are, there's a long list of considerations that had to be addressed in this transition. And in fact, earlier this afternoon in the Committee on Administration endorsed some of the plan for the transition related to transition of leave banks, transfer or conversion of paid time off, all of those sorts of things. So staff will come over in the sense of their benefit package for leave and sick time, vacation time and sick time. They will come over just approved earlier today, or just endorsed earlier today. They will come over with credit for service time served with house calls. However, there isn't a way to go back and do that with Wisconsin Retirement System because they were not they were not government employees, which is one of the predicating factors to being in the Wisconsin Retirement System. However, they will go forward with WRS participation as of January 1st.
I have another question there, Madam Chairman.
Yes, please.
Once this transition happens, does that absolve us of any further liability or along those lines regarding these people?
I don't know that I can say that or know an answer to that question. I've always been of the mindset that anyone can bring legal action about anyone at any time about anything. In practical reality, I think that we have been thoughtful about making the decision, about making a fair conversion, and about being planful about it. And so I think that all of that mitigates some of that risk. But you know, I obviously I can't promise that.
Well, and no, and I understand that. I just meant generally speaking that when this process is done, it should be done, notwithstanding the fact that some individuals might pursue something. But thank you for your answer.
The county will have mitigated some of the risks in the gray areas in that sweet spot of intersect the various pieces of law by making this move.
Supervisor Kennedy and then Mr. Lamb. Go ahead, Sarah.
I have a question on whether these employees, when they become county employees, will they be getting comparable county wages?
Yes.
Okay, thank you.
Mr. Lamb.
just kind of related, well, two things. First, it's related to what Gary mentioned. And from Chris, when I spoke with you about this, when I got some calls and you gave me a wonderful explanation, thanks again. And I understand the impetus of this came from some correspondence from a federal government or something, I forget which agency. And obviously, if I recall, they would have had the ability on their own as a governmental agency to step in and take some action against the county. And I'm granted individuals have their own private right of action, but the federal government has that option as well. And you may not know this, Chris, but I'm assuming as part of resolving all this with that agency, whoever it was, Department of Labor, some bureau, has that been resolved so that we at least know that there's not going to be any comeback from them? I mean,
so just to clarify, there was not ever any inquiry and or action started on the part of any other oversight organization. I think that quite honestly, how some of it began with our internal interest in taking another deep dive into it came when there were county staff who've retired as county employees and then were interested in perhaps doing some part-time work as leased staff. And it raised the issue, the very first sort of revisit of this, the issue was, are they rehired annuitants to the Wisconsin retirement system? And that's sort of where the line of questioning began. And then that led to sort of a deeper dive into understanding that there were multiple layers of regulation from a number of different organizations. And very difficult, honestly, to find someone who's well-versed in all of those areas to be able to even provide solid sort of legal consult about that.
Okay.
Any other questions for Kate, for Chris, or discussion of this? All right, excellent explanation, Chris. Thank you.
And then Sarah can do the financial report.
Thank you. I'll share my screen if I'm allowed to.
Please.
Can you all see that?
Mm-hmm.
All
Yes.
right. Okay. I'll just go to column F with the projected. If everybody's okay with that, I'm sure it appeared in your packet. So we have a grand total with Human Services of projected expenses of $12,836,844. I divide that out with our operating and salary. Our operating projected expense is $7,853,316. And our salary is $4,983,528. So then that totals back up and we show our revenue coming in at $9,460,244. We had budgeted $4,178,916 request for county levy. At this time, with where our expenses and revenue are, it looks like we are only so far going to need $3,376,600. So in the corner here, it shows a possible return of $802,316.
And Sarah, these data are current as of the end of August or July?
These are the end of August.
August. Thank you.
Mhm.
Questions for Sarah or for Chris?
I would just add a couple of little points of reference. So I think that the pandemic has certainly changed some patterns of spending. So our travel expenses have sort of dropped off to next to nothing. Our conference or professional development expenses have dropped off as significantly, as well as many things are held virtually and often at no cost. However, those are, in the big picture, relatively small portions of our budget. But I think that some of the other things that have changed over time is, one, there's been significant supplemental money that's come through in various ways, shapes, or forms to many of the standard grants that we receive. As money has flowed from the federal government to the state government and been divvied up between the various departments, they've filtered some of that money through to the county. The other thing is that and we've talked so often about our comprehensive community services program, but quite honestly, it occurred to me one day when I was trying to think about why we were in very solid financial shape, that we are offsetting a fair amount of service costs that we used to pay for flat out of pocket without another funding source. We're now offsetting those by being able to provide them through the CCS program. And so all the way from some of our youth wraparound type services and even some placement costs, all the way through a lot of the adult services as well. And so I think as that program grows and matures, we're beginning to see pretty significant benefit to our involvement in that program.
Any other questions? All right, thank you, Chris and Sarah. Action items, September DHS vouchers paid. Sorry about that. I will need a motion to note review of the vouchers for September. The amount is $767,515.77. Mr. Lamb moves. Supervisor Steen seconds. Any discussion? If not, that is approved. The vouchers are noted for September vouchers paid. And we do have what I thought was an extremely well done 2022-2024 aging plan for the ADRC. And I would certainly hope that people took time to read all 95 pages of it. It was well done and very good data collected in support of this plan. So Chris, whatever you would like to share with us, and then I'll entertain a motion.
So I did spare several trees their lives by not printing that and sending it on to you. That So we are required by the funding sources through the aging program side of the ADRC, which are funded through the Greater Wisconsin Agency on Aging Resources, GWAR. We are required to do a 3-year plan. I would note that my agenda said 2021 to 2023, but it's actually 2022 to 2024 that we were working on because we're just finishing up the 2021 part of the previous plan. And so basically, while some of the things in terms of the summary page and the goals that were provided to you in your packet seem fairly elementary, I think they provide a bit of a roadmap, or maybe almost like the bumble strips on the side of the road, or maybe in the middle of the road sometimes now, but sort of the rumble strips on the side of the road that help us to sort of stay in line with what it is that we're attempting to accomplish through the receipt of those aging monies. And again, the primary supports that are funded through aging, the aging side of the ADRC budget are caregiver supports, which include the groups, as well as the some of the financial types of support that we can provide by way of respite or daily living skills types of activities, supportive home care kinds of activities. The transportation program, our 8521 money that passes through for doorstop bus service and volunteer drivers, and the nutrition program, senior nutrition program. So those are the 3 primary aging programs and the focus of this this plan. So it does require, was approved by the ADRC advisory committee, and now we are looking for approval on your part of our ability to submit the plan.
And I will happily entertain a motion to approve the 2022-2024 ADRC.
I so move.
Supervisor Steen moves and Mr. Lamb seconds. Thank you for that. Any questions? Any further discussion? Supervisor Kennedy, Supervisor Bjork, you're on the ADRC advisory committee. Anything that you would like to add?
This has been very, very well thought out, as it has every year that I've been involved with this a couple of times. And so I think we do our ADRC does a great job. It's one of my favorite committees to ever have worked on. So I just want to commend them for all the hard work they put into this document.
I agree. It's an excellent plan. Supervisor Bjork, anything that you would like to add?
I would wholeheartedly agree. I'm amazed at the effort and the dedication that people in the program have in delivering services to Dunn County residents.
All right, are we ready to call the question? Yes. All in favor of approving the 2022-2024 aging plan, ADRC aging plan, signify by saying aye.
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 Any opposed? Passes.
If I could just add one more little side note,
certainly.
The ADRC advisory committee is aware of this, I believe, but Lonnie Dodge, who was the home health program manager when we had home health within the Department of Human Services, and then became the Aging and Disability Resource Center manager when home health closed, and we did some internal shifting around and needed some extra bodies in some other spots. So Lonnie stepped in to be the ADRC manager, and she's going to retire on December 1st.
Yes.
And we have offered and accepted offer of employment to Tracy Fisher, who's been the Director of Social Services at NDC for a dozen years or so. And she is coming over to be the ADRC manager. and she is super excited. So she even replied yay when I sent her a meeting invitation. So I think that's like excited.
And she will be a fabulous asset to that program. I know Tracy very well, and she will be great at it.
Nice. I've
That's
heard
great.
nothing but great things.
That's
Mhm.
really good news. All right, one more action item. We have a bunch of budget adjustments. Chris, do you want to walk through this? Or, I mean, it's pretty self-explanatory.
It's pretty self-explanatory. If there are any questions, we certainly can answer them, but
All right. I would like a motion, please, to approve these 2021 budget adjustments and pass them on to County Board. Supervisor Steen moves. Is there a second? Supervisor Cromrie, thank you. Any further discussion? Questions? If not, all in favor say aye.
Aye.
Opposed? Budget adjustment passes. And that is the last item on our agenda, except that we will be meeting on the third Thursday in November. That would be the 18th. Supervisor Steen.
Yes, I'd like to thank Krista and Kristen for finding me tonight.
We were all temporarily lost. with Supervisor Steen, but have been gathered to the
Plan,
fold.
we'll have to plan better for next month because we purposely tried to lose you, Gary.
I'm taking the hint. I'm not coming. So there.
So if I
All
can take a
right.
quick second and say thank you to the supervisors that provided lunch. We had a couple of you guys that sent over meals for our team this last month, and it was greatly appreciated. So thank you guys very much.
And thanks to our staff for always being extremely informative and very helpful and making our work ever so much easier. So thank you all. If that's it, we are adjourned.